recording yet, but we are recording now. So if you do not want yourself to be recorded, you can turn your camera off, and that is an option on the bottom left of most screens, I hope, but to say stop video. You don't have to do that, but if you'd like, you are welcome to. Great, welcome to this evening's program. Tonight we are here for what can we do in our community to address affordable and available housing in our community. Tonight's program is a collaboration between Forbes Library and the Northampton Human Rights Commission. And we hope the beginning of more joint programming on this and other important topics to our community. Tonight's program would not have been possible without the support of Faith Kaufman on the Forbes Library staff, who is on hand tonight to help run the technology. So if you have any technical questions or concerns, you can go ahead and put those in the chat. We will also ask people to stay muted during the program. At least initially, we may open it up during questions, but for now, we're asking people to utilize the chat to put their comments or questions, and we will take as many as we can at the end of the program. We also couldn't have put together tonight without Pamela Schwartz, who helped me frame this discussion and invite our wonderful panelists that we have tonight. She is the director of the Western Massachusetts Network to End Homelessness, and I will now turn the floor over to Pamela Schwartz.
Thank you so much, Lisa, and welcome to everyone. It's a pleasure to be here. So appreciate the commitment and concern to housing in our community. And we're here to have a discussion about it, learn and exchange around how we are addressing this issue. And we're going to start by grounding ourselves in what the issue looks like and how we are, what is in our community in terms of housing and its supply, its availability, its cost, its burdens. And we have a true leader in this work to help ground us. And he is Keith Ferry, who is the president and CEO of Wayfinders, who will describe more about all that Wayfinders does. They are the leading housing agency in our region. And it's an honor to have him here tonight. So welcome, Keith.
Thanks, Pamela. Great. Good to be with you all this evening. Really appreciate the opportunity to talk with you all about housing. Again, as Pamela mentioned, I have the privilege of leading an organization called Wayfinders. Some of you may have heard of an organization called HAP Housing. HAP Housing became Wayfinders about 7 years ago or so. And I became the CEO of Wayfinders in July of 2020. Wayfinders is about a 50-year-old organization. I serve about 40,000 people a year through our various programs around the housing continuum, everything from sheltering homeless families to helping build and manage and support people in affordable housing, to providing rental assistance, both for emergency rental assistance and rental assistance through government programs like the federal program, HUD Section 8 program, or the Massachusetts program, the Massachusetts Rental Voucher Program, to home ownership. And we also work on small business development and other community development projects. So I could go on about that, but that's not why we're here, and that's not why I'm here. I'm here to talk a little bit about work we've done and we do and trying to help people understand the context around affordable housing in our community and in our region. And as I mentioned, Wayfinders is a regional organization serving all of Western Massachusetts. Concentration of our work is in Hampden and Hampshire County with all that we do, and then we do work throughout the other 2 counties as well. So I'm going to share my screen, share a few slides to kind of provide some simple context around this and framing for the balance of the conversation this evening. And here I go. There we go. Great. So our housing challenges, as I say here, I want to understand the regional housing challenges. Yes, we're speaking on a Northampton forum here, but Northampton is not an island to itself. The region has kind of a mix of housing challenges and opportunities that intersect across counties, across cities and towns. And there are challenges and there are opportunities. I think a lot of some of the data I'm going to share is going to be pointing at problems. But I want folks to understand that these are solvable problems. This is not intractable. We got here over years, decades in some cases, of lack of investment or lack of coordinated strategies. And it's going to take time to get us to a better place with some of the issues I bring up today. But there is an opportunity to solve if we begin to work together differently, and we'll talk a little bit about that. And there's things in the immediate term we can do, medium, long-term strategies and actions that we can take as well. So a little context around housing affordability. Housing affordability is relative to your income. And I just wanted to talk about income for a second, relative to this is income data leading up to the pandemic. And what we see here with this data leading up to the pandemic, we looked at income across, and this data that I'm sharing with you comes from a regional housing study that I'll put in the chat that you can take a look at your leisure. We released with the UMass Donahue Institute and the Greater Springfield Housing Advisory Group for the Pioneer Valley, Hampden, Hampshire, and Franklin County. And we looked at a number of different things, economic, housing, and demographic indicators in our first phase. In our second phase, which we're just getting ready to release in the same study, we looked at housing affordability in each community and housing mismatches, as well as COVID-19 and housing issues and opportunity and segregation in our region. One of the things though here, when again, looking at housing affordability, this again from the study, shows that what incomes look like across the Pioneer Valley leading up to the pandemic. This is the 2 charts on the right, 2 bar graphs from 2013 and then 5 years later, 2018. And what you see here is income is a key variable in being able to afford your housing, whether you're a renter or an owner. And you see significant gains in income for white and Asian households over that period. But for Black and Hispanic households, you see their incomes are unchanged over that 5-year period leading up to the pandemic. And certainly reading from the headlines and experiencing the pandemic, we know that there's been really economic costs for all of us. But this is the kind of context that people went into the pandemic in from a racial and ethnic perspective. So when we look at housing, and Pamela used the word burden, we look at there's a term of art in housing called being cost burdened, and that's when you pay more than 30% of your income on your housing costs. And so the chart on the left is for renters, the chart on the right is for owners. The red bar is for 2010, and then the latest available data for 2019. And so what we see here is comparing Massachusetts and the 3 counties of the Pioneer Valley. We see here that renters are more cost burdened than owners, and that the renters in our region, especially in Hampshire and Hampden County, are more cost burdened than renters in the balance of Massachusetts or the Massachusetts overall. So that's something that when giving context regionally and for the state, people often think about Western Massachusetts being more affordable, affordable to whom, though? Again, it's relative to your income, right? And so you have to, so yes, if you bring a salary from New York or from Boston here, it would be more affordable, but by the salaries that we're paying here and what the median incomes are, these are the cost burden concerns that begin to come up for families. There is another thing called being severely cost burdened. We're paying more than 50% or more of your income. And again, in that category as well, for renters, it's worse. And when you're in that category, you're really at 50% is called being severely cost burdened. And we see many of those renters, those are the people on the fence. Those are the people who, one health crisis, losing hours on the job, that moves them from being stably housed to being on the doorstep of eviction potentially. So I'm going to move on and just look at this. Looks like cost burden in a different way, and it's same and looks at it across the counties, and it looks at it by income bracket. So if you're thinking about who's going to be the most cost burden, no surprise that people with the lowest income have the highest cost burdens. So that's what the chart on the right is showing you. It's looking at the income levels and then for each county and compared to the state, and whether at the percentage of those renters who are cost burdened. We're just looking at renters here. And you see as you go up, the cost go up the income scale, in this case go down the chart, you'll see that once you get above 50,000, then the cost burdens really drop. But in Hamden and Hampshire County, from just below 50,000 down, you have over half of renters being cost burdened. And when you get below 35,000, we have in Hampshire County even more renters than the Commonwealth overall being cost burdened. The other part of the dynamic here is housing supply. And what this set of bar charts is telling us is that we do not have enough housing in our region. And those of you who understand the principles around supply and demand, know that when there's a limited supply, that can often result in higher prices. And that's what we're seeing right now during the pandemic. There's a very limited supply of available housing at any income level, at any affordability level. And so that's one of the big challenges we have. So how do we get here? Part of this is about demographics. We have people who are thankfully living longer, aging in place in their homes. So they're not moving on from homes that would, and we have a big population there, people who are staying in their homes and living in them longer. And then we have the millennial generation who are now starting households, looking for homes, looking for opportunity to either rent or own in our region. We also have an issue in our region where we have extremely old housing stock, older than the Commonwealth overall on average. And that can lead to some of the housing stock going out of use. We can lose some of that housing stock because of functional obsolescence. And so there are a number of factors that get us to the bar on the left. It shows you at 0 and up, that's when we had an excess of housing stock in 2010. And what this goes through is 2025, and what the Donahue Institute's analysis shows based upon households who need housing and households that the housing in our region. It shows we have a housing supply gap right now of about 11,000 units, projected to grow in 2025 to about 19,000 units. And then what's going on with the existing supply? That's another thing that drives the cost of housing and creates the cost burdens that I was talking about. Again, looking at from about a 9-year period here, looking at vacancy in our region. And what we're seeing is that vacancy rates have come down for the most part, although this is pre-pandemic data still. We're still analyzing, trying to get the latest numbers, but not quite out yet for this. But leading into the pandemic, we're seeing vacancy rates come down, somewhat come up in Hampshire County, but still a pretty tight band between 3% and 5%. And that's not a lot of availability. There's not a lot of units there. And again, when you have a tight market like that, and we see this, I'm sure you've heard anecdotally about people trying to find apartments, hard to find them, very competitive marketplace for them to rent with this limited amount of supply that's available. And the homeowner vacancy is even lower. So around 1%. Again, this is leading into the pandemic. So we shouldn't, I know it seems like a surprise now, there's lots in the news about the limited number of homes on the market for sale, or homes available for sale, but and this is just not the same thing as being available for sale, but vacant homes that could be for sale. We're only seeing a vacancy rate of about 1% in our region. All these dynamics create issues around affordability, and they create them across income levels. As you saw on that renter chart I was showing you, it's not just the lowest income people, it's people across income levels that are having a hard time affording their housing right now. And these are some of the dynamics that cause that. So I think that's what I wanted to share, just to provide some of that context for the discussion today around housing affordability. I will put into the chat a link to the Greater Springfield Housing Study that covers Hampden, Hampshire, and Franklin County. Phase 1 is out. Phase 2 will be out in the coming months, in the coming weeks, I should say. But I'll turn it back over to Pamela and the rest of the panel to continue the conversation this evening.
Thank you so much, Keith. What a powerful foundation. And I know we all look forward to using that as we get to our discussion. Now we're going to continue learning and laying our groundwork. And our next speaker to help us do that is Gordon Shaw, who is Vice Chair of the Northampton Housing Partnership. Welcome, Gordon.
Old unmute the Zoom issue. Hi, good evening, folks. And I just want to start off by saying how wonderful it is to see the turnout tonight. I mean, it really says something about our community to see so many people show up for something which might be considered a very dry and very technical conversation. But anyway, as Pam said, I am the Vice Chair of the Northampton Housing Partnership. And just by way of professional background, I'm also an attorney. I work for our Western Mass legal aid program called Community Legal Aid. It's serving all of Central and Western Massachusetts. But tonight I'm here to speak to you about the work that we're doing on the Northampton Housing Partnership. So let me begin by just telling you who we are and what we do. So we are a mayoral appointed volunteer board. We have 11 seats on the partnership, and we currently have 2 vacancies. So if after tonight you are inspired to want to do more and looking for ways to contribute, you can seek out information about how to become a member of the partnership. But we meet monthly for 90 minutes on the first Monday of every month. And until further notice, our meetings are by Zoom. But these meetings are also public, so you don't need to be a member to attend. And we do publish before the meeting, and usually about a week in advance of the monthly meeting, our agenda, along with information of how to join in through Zoom. So what's our purpose? Well, we're charged by the city with identifying and addressing Northampton's housing needs, with particular emphasis around the need for affordable and attainable housing for households with low and moderate incomes. But to put that more plainly, I think of our role as being an advisory board to the city and all of its departments and committees on issues around housing. And an example of that is that we often will vet proposals for CPA funding that involve housing. We do work closely with the planning board around issues with zoning, often issues when zoning issues come up that have an effect on housing. Often we are asked to sort of share our opinion and give some feedback on those changes. But I want to tell you about 2 very important city housing planning documents that we were behind. In 2011, with the support of CPA funds, we were able to procure a housing needs assessment and strategic plan. And then in 2019, we also worked with the Pioneer Valley Planning Commission to obtain a study and report on the barriers to fair housing in Northampton. And both of these reports can be found on the city's website. And much of the work that we do in the partnership has been informed by these reports. And I just want to tell you about two initiatives that we are currently working on. And these came directly out of barriers that were identified in that fair housing report. So we are currently working with City Council to pass an ordinance that would prohibit rental agents who work for landlords in screening prospective tenants from charging a fee to the tenant. Currently, this is the prevailing practice in our area, and the net effect of this practice is that it makes it harder for lower income households to have the same access to rental housing as those with higher incomes. And I should probably add that even those with higher incomes reluctantly pay that fee in order to be able to just get access to our rental housing market. And the way the fee works is that the tenant prepays as much as a full month's rent just to be shown available vacancies, and there's no guarantee that you'll even get that apartment. So when you think about what that means, so when you're trying to save for first, last, and security, which is often what it takes to be able to rent, this additional fee can put access to Northampton's rental market out of reach for so many. The other initiative that we're working on is a collaboration with our local housing authority and neighboring communities to tackle the barrier that persons who've been issued Section 8 vouchers have with being able to locate housing in the Upper Pioneer Valley. For those that may not be familiar with how a rental voucher works, after waiting many years for your name to get to the top of a list, and typical wait lists are now running something like 4 to 5 years, a housing authority, or possibly wayfinders, issues the tenant a voucher and then tells the tenant that you have 60 days to find an apartment that meets the requirements of the program. While there are ways that you can get an inspection for good cause, the bottom line is that if the tenant cannot find an apartment within that time period, the tenant loses the voucher and then probably has to reapply for the program, returning them to the bottom of the wait list. So what's the problem? Well, when you get issued that voucher, you were told that the monthly rent for the unit cannot exceed what HUD has set as the fair market rent for the region in which you're looking to rent. And the problem for us in the Upper Valley is that we are part of a fair market region that includes Hampden County. It's probably evident to all that the rents in Northampton are not in sync with rents in, say, Holyoke or Springfield. So out of necessity, tenants who have been issued a voucher by our local housing authority frequently end up leasing in communities to the south because that's where they can find a rent that fits the program. I should also add that this is a regional problem, even for the Lower Pioneer Valley. Tenants also struggle to find qualifying rentals, even in Hampden County and pretty much everywhere in the United States. This is a huge issue for the Section 8 program. So what are we doing? Well, right now, we are seeking the help of our federal legislators to address the gap between fair market standards set by HUD and the reality of our local rental housing market. And so before I pass this on to our next speaker, I just want to make a sort of overarching observation around the challenges we face here to ensure that Northampton is a community where households from all income levels can live. And that is that we are very much a victim of our own success. And simply put, we are a community that a lot of people want to live in. And so the familiar laws of supply and demand require us to be proactive, to be intentional in our approach to providing affordable housing. It just doesn't come on its own. And that's the important message that I want to leave you with from this discussion tonight, that you need to be proactive. It just doesn't happen by itself. With that, Pam, I guess I'll let you introduce our next speaker.
Thank you very much, Gordon. Really appreciate the information and the description of our challenges that will be subject of further discussion and solutions. To continue with laying out the landscape here in Northampton, We have the privilege of hearing from Dr. Jessica Bossi, who suggested I introduce her as a woman of many hats, and she will help describe those hats in her comments to us. So welcome, Dr. Bossi.
Thank you, Pam. Hi, everybody, and thank you so much for having me to this talk. I also just want to compliment Gordon. That was a very descriptive and very informational way to describe a very complicated problem. So I really appreciate your ability to kind of lay that out. I wear a lot of hats in this community. I am the one full-time medicine doctor, primary care doctor for all of our houseless individuals for the entire region. So that includes Hamden, Hampshire, and Franklin County. I have thousands of patients in this region that I care for, in both the homeless shelters, on the streets, in their encampments. I have also done a lot of work for the public health department surrounding COVID and our houseless individuals who've had difficulties accessing things like testing and vaccines. And I've recently moved into some work in the housing sector, which is why I am here tonight to talk with you guys, and specifically talk about how we're trying to be pioneers in the Pioneer Valley and create sort of some new solutions for housing and the problems that were just discussed. So when I started my work 4.5 years ago with Health Services for the Homeless, my work providing sort of complete spectrum of care for adults in the homeless shelters and on the streets was really what I expected. It was challenging. It was very interesting. It was very much sort of a lot of problem solving involved, but we were able to be really effective in our work and provided excellent care in the shelters and on the streets, and really brought healthcare to our houseless population. We've had enormous success with many patients in those settings, and what I didn't expect was the amount of challenges when we housed an individual, when we housed a person, which was obviously our ultimate goal, right? To get the person stabilized and then housed. There was a large subset of individuals who were housed, waiting years sort of for these housing vouchers, and then would be put into a unit. And we started seeing sort of decompensation of illnesses and conditions that were previously completely stable. We started having evictions. There were, emergencies, crises, near evictions. There was issues with folks failing their public health inspection, the housing inspections, et cetera. So these kind of crises took an enormous amount of time on many levels. And in addition to that, worst comes to worst, there was an eviction. The person who we had worked years to house would then go to the bottom of the list that Gordon talked about, and they would repeat the cycle of homelessness, which is something that is just a catastrophic consequence. So I, as a provider who saw this cycle, I needed to find a solution. I also, of course, note that there are those who just have a voucher and they're sort of independent and are not being able to apply it because of the overall lack of housing. But my role here is to kind of discuss some of what housing looks like for individuals who may not be fully independent, which is a sort of next layer of complication. So when you talk about someone who can't meet all of their own needs for whatever reason, they're physically handicapped, they have some mental illness, or they have memory issues, etc., some functional impairment, but not complete impairment, just some. We think about a lot of different settings, and I think the first one people automatically think of is a nursing home, and so that is a very complex facility that sort of takes care of everyone's needs, from 24 hours, there's doctors and nurses and, tons of staff members, physical therapists, occupational therapists. Some of these facilities are covered for a certain number of days by insurance. For example, if you're over 65, Medicare will pay for 20 days. Mass Health, you have to qualify, and for like very dependent care, you have to have less than $2,000 of assets to qualify for payment for some of these beds. And you have to have a significant amount of physical or functional needs to qualify for one of those beds. And I'll note the importance of being over 65 is that's one of the main sort of criteria. So for a long-term care bed in a nursing home. The next level down is something called a rest home. There are 2 in the Pioneer Valley. One is in Springfield and then one is in Northampton. They have a little, the 24-hour staff, but you can come and go when you please. There's a little bit of flexibility there. The door is a bit more open, and there's not something like a registered nurse or a physician there. The downsides of these facilities, all of them, is that a person is required to give any of their monthly income to the facility, and they're allowed to have $72.80 for spending money every month. That's not a very attractive scenario for a lot of different people who feel that they need more than $72 a month to just meet their own needs, buy things like clothing and brushes and shampoo. And, if they're a smoker, that's a big barrier. So we tried to put folks in all of these both of these scenarios, and it was generally unsuccessful. We've had some great success stories where it did work, but overall a nursing home was a very rigid sort of model with really monotonous day-to-day routines, and people who have experienced a lack of housing and they don't even know where they're going to necessarily sleep from one night to the next. It's difficult for them to sort of fit into that very monotonous routine right away. It's very jarring. And then the rest home is, the next option, but generally the preference for someone who gets $800 a month from Social Security, which is a pretty average amount of Social Security income, they'd prefer to stay at a shelter and be able to spend their $800 instead of having to only spend $72, because they can meet most of their needs, just not quite all of them. So myself and the director of the local rest home became quite close during this process of attempting to get, we had some success stories together in the rest home, and we had others who just were not a success because of the monetary sort of constraints. And there was just this gap. So there's those 2 things that I just discussed, and then there's this big gap in housing. And on the other side, we have completely independent housing. And there's really not a lot in between. There isn't anything in between. And so we would have folks going into independent housing, just like Gordon was explaining with a voucher, but not being able to fully understand, for example, how to pay rent, how to really operate a bank account. These are not skills that folks necessarily possess. There was also issues just with behavioral stuff and how can we support this population? How do we close that gap a little bit was our goal. So I started a nonprofit called Independent Housing Solutions, and our goal was to provide an array of services that would look like would look like assisted living, which, as I'm sure many of you are aware, is extremely expensive and a financially, profit-based program that costs anywhere between $4,000 a month and $10,000 a month, depending on your need, which impoverished people certainly cannot afford. And to create something that provided sort of the list of options that you would get at an assisted living community. So we banded together with many of the service providers in Northampton, and we're closing on what used to be a nursing home at 5 Franklin Street in Ward 1 in Northampton, and we are building a 16-room what we call a single room occupancy, where everyone gets their own space and their own room, but can share more of the community kitchen, and there's like community sort of living area, and also can pick from a wide array of services such as hot meal delivery from Mana Community Kitchen. We've got caseworkers coming in. We have folks coming from Greenfield Savings Bank to help individuals learn how to use their finances. We have on-site medical staff. So we've got nursing coming in every day. And we also have a physician coming in at least once a week to sort of oversee things. And we're doing this not under one entity, but as a team. The folks that are the best at providing the meals are providing the meals. The folks that are best at providing the medical care are providing the medical care. And we have a housing developer who's come to the table and helped us with the development piece for this project. We're very hopeful. I was talking to the Massachusetts Shelter and Housing Alliance recently, and the president noted that this is an aging population. And, we sort of like the baby boomers. He noted that the homeless spike in this region really was 1990. And so, we're 32 years later, and we are seeing a lot of folks with complicated medical needs and issues who are, over the age of 50, but not 65, who really need some support. So we're doing our best to provide that, and we will be accepting, of course, the vouchers that Gordon was describing. And these would be sort of a project-based voucher, which is a different kind than a Section 8. But just trying to lay the groundwork for different ways of developing this housing. And lastly, I'm going to show you a couple of slides just with what it is going to look like. And I would just state that our project is also, instead of going through a 3-year sort of grant cycle with the state, we have found ways with some private partnerships and a combination of both public and private collaboration to really do this in a quick way, as opposed to waiting 4 or 5 years for this process to sort of unfold. We were able to close on a building that was available then and renovate it, and we're going to open in July. So a lot of folks are sort of looking at this as a very different way of doing things. And again, the state is very interested in this project and really happy, and I'm very proud that it's happening in our own community. So something to look out for. I'm just gonna share my screen really quick and explain a little bit about what an SRO looks like. It's called a single room occupancy. Hold on one sec. I'll just share this. All right. Can everybody see that? Let me just try to go to the slideshow. All right, sorry. Okay, so a single room, this is the building. It's on 5 Franklin Street. There's Elm Street. We're gonna redo what is right now just a sort of paved parking lot. We're gonna turn that into a nice garden area, patio area, covered sort of back garden for the tenants. This kind of commodity is not generally found in a single room occupancy setting, which are normally very large buildings that have businesses on the bottom of sort of floor, and then small apartments on top, or single room sort of settings on the top, efficiencies, etc. There's a lot of different kinds of housing that's we won't get into today, but the inside, we're going to have, instead of a business sort of operating on the ground level, Tandem Bagels or a shoe store. We've the ground level is going to be utilized for the tenants themselves and to provide support services. So a physician's office, we've got a nurse's station, dining area, and a common like TV or entertainment space, which generally is not found in a single room occupancy kind of setting. Usually there's a sparse kitchen, which doesn't even always have a refrigerator, a microwave, a toaster, and then that's pretty much it. And then there's just sort of rooms. So this is going to be a bit of a step up, and we're very excited for that, to elevate our folks to a sort of different level of living. We've been mindful to include bathrooms for folks with handicaps and disabilities. We specifically purchased a building with an elevator to make sure that all of our rooms would be ADA accessible. I will note that the 2 rest homes in our region are not ADA accessible. They do not have wheelchair access. So anyone that would want to go to a rest home that has a handicap is unable to. They need to be able to navigate quite a few stairs. And then these are the rooms themselves. They're much bigger than what you would expect in a single room occupancy. We've actually had about 1.5 to 2 times the typical space. And we have, again, just been thoughtful about folks who may have different kinds of needs. So everything is ADA accessible, with turnaround spaces for electric wheelchairs, for bariatric clients, etc. So that's we are doing great things here in Northampton to close the gap and to find housing solutions for our lower income neighbors. And with that, I will turn it back to Pam.
All right. Well, thank you for giving us hope. And I mean, I know there are a lot of reasons for hope out there. We're going to get to them too, but I just want to say thank you for your extraordinary work and your vision and your commitment and bringing this deeply needed housing stock to Northampton. It really is so hopeful and inspiring. So thank you. So now it's my turn to talk to you for a few minutes. And then we're going to lead into question and discussion, which will be the remainder of our time, which we're really excited to get to. So I'm just going to give you a couple of minutes on the Western Mass Network to End Homelessness, to the extent that it is a vehicle for change, for making policy change. And first, the network itself. It's so funny. I'm not used to seeing myself spotlighted. So it's like, wait, where are you other squares? I'm really rather looking. That's the only reason to screen share when you're spotlighted. Okay. But I wasn't planning on it. So I'm just going to have to tolerate it. Okay, here we go. So the network is an entity that brings together every sector of our community across the 4 counties of Western Mass. And I know Keith is a core member, a partner to the network, part of our steering committee. I haven't had a chance to look down the participant list to see who else might be part of our network, but I trust you're out there. It's a vast network that includes obviously our housing and shelter providers, but also our community college presidents and our healthcare leaders and our workforce development boards. And of course, all of our frontline workers across childcare and public transportation. And what it takes basically to end homelessness is every sector coming together to coordinate, collaborate, and aim for this mission of preventing and ending homelessness with a housing first approach, which is everything that Dr. Bossi just described. The best solution to homelessness is housing with accompanying supports. And we do all of that with a racial equity lens, defining through how do we close the racial inequity in homelessness, which is stark and searing in our community as much as it is everywhere else in our nation. So we do that a couple of ways. We do a lot of comings together in a lot of different constellations. But the thing that I want to focus here on is our advocacy work, because that's what can bring you in. We offer this vehicle for a united voice across the region to say we need to do housing first policies. We need to both adopt budget, we need to fund adequately our housing initiatives, our subsidy programs, our programs for unaccompanied homeless youth, our permanent supportive housing programs, which is exactly what Dr. Basti just described. And then we need to pass laws that will actually address our affordable housing crisis. And here's the good news. Here's another source of hope. There are laws on the docket right now that are inching towards passage, where all of us together will help make it happen. And it's a very ripe moment in our legislative session, state legislative session. For those who are not as familiar with this world, the legislative sessions work in 2-year cycles. We are in the last half of the 2-year cycle, and really effectively in the last quarter, because a formal legislative session, it's a term of art, ends on July 31st. And that's when there's informal session, quote unquote, until December 31st, way harder to pass bills. Then you have to have unanimous consent. That's not likely to be our bills that get unanimous, but so July 31st is traditionally considered the deadline in the formal session. So we're on February 9th. We have till July 31st to make laws happen. The great news is we have a very supportive legislative delegation on many of our top priorities. But to give you just a sampling of what I'm talking about, it's, for instance, Tenant Opportunity to Purchase Act. That's a bill that's pending that we can make happen. That would give tenants the right of first refusal when an affordable housing, when a home or a building is up for sale, and there's a local option. Our community could adopt this law if the state passes the Tenant Opportunity to Purchase Act. It's a local option law, means the community can adopt it. Northampton could adopt this law, and we would be in a better position to preserve housing from being flipped. Another example, the local real estate transfer fee for affordable housing. Proud to say, we can all be proud that our Senator Comerford is the lead sponsor of this legislation. We also can be proud to say that our city council in Northampton has adopted a resolution in support of it. What is it? It's an opportunity, if the state gives us the choice, to adopt a law that would allow us to raise revenue for affordable housing through the sales of the most expensive properties. In other words, it's a progressive fee. And we as a community would have the choice about where that fee rests, between 0.05, 2%. It's just an opportunity to create revenue for affordable housing in our community. That's another example that's on the docket that has not yet gotten out of committee, and we have an opportunity to push for it. Another example that I want to give to you is this is a housing stability measure that is super crucial, which is the right to counsel in evictions. Right now, and I know Gordon could speak to what he sees in his office, I'm sure ad nauseum, but this is the reality. I'll just give a couple of data points to bring it home. Right now, close to 90% of landlords have lawyers in the face of eviction, as compared to 10% of tenants. It is a monstrous justice gap. It is such a gap that late Chief Justice Ralph Gantz of the Massachusetts Supreme Judicial Court went on record as saying, we cannot have a just housing law without tenant representation. It's a complicated law, and it requires representation to actually have your best chance at preserving your housing and knowing your rights. And while we have, thank God for community legal aid, what they do is heroic. And we have people slipping through the cracks invariably all the time, because they don't know that they have access to representation, and or they get a notice to quit. That first paper, that is absolutely not a basis for leaving their apartment, but there's panic, there's fear, they vacate, they become housing unstable, not to mention the trauma. So that the right to counsel in evictions is another example of a law that is pending that we can push together. So I'm just stopping there. There's a long list of our network priorities and our legislation that we can pass. And all of these pieces of legislation would make a huge impact in addressing our housing crisis. So what do we do about it? We connect. And when I stop talking, I'm gonna put the link in the chat to join the network blog. Right now, we have over 650 subscribers across our region. We need you too, because the network blog is our way when there is a bill that's up for a hearing, although the hearing season has passed, but we are going to be in direct communication with our legislators and the leadership around pushing these bills that I just mentioned and many more through to a vote, to the next stage. So your single email to legislators will make a meaningful difference. And that is how it works. If we can, 600 of us can send an email to our respective legislators as constituents, and even Senator Comerford and Representative Sabadosa, to the extent most of us here are from Northampton, presumably, just be advised, they need to hear from us too. They would, if they were on this Zoom, they'd be the first to say, talk to me. I need you behind me to get to leadership, to say my constituents are demanding that this happen. It helps them. So just please take that into account when we go, we got it covered. We have the most amazing representation. No, we don't. I mean, we do, but we're not done. We're not done. So I'm going to stop talking and put the link in the blog. I can't only do so many things at once. And I just want to welcome you to join us and feel the power of us together making an impact on the state level that will then come home to our community. So that's me. Okay, so now I'm switching to MC. This is a funny thing I'm doing. I think we're at 7:53, which is exactly what we hoped for. And we get to move into questions and discussion. And this is when, Lisa, I realized we were always where you, this is where you take over, right? Have I got this?
Yes.
Yeah. Awesome. Okay. Stay tuned for what's the link in the chat, everyone. And please sign on and subscribe. Okay, there we go.
Well, thank you, Pamela, and thank you to each of our speakers for laying out what has been described as a complex problem with many, many components in a way that it felt very real to me, and it feels the challenges are real, but the solutions also feel very real. So thank you for that. So now it's time to answer questions. There's a few. I'll start with the ones I already see in the chat. If you have something you'd like to ask, please go ahead and put that in the chat. So the first question we have came in the context of, I think, rising housing prices in our community. And Gordon, you referenced this, that we're sort of the victims of our own success. It's a wonderful community. People want to live here. This particular person mentioned the rail trails and sort of and so many amenities and great things about Northampton that have raised housing prices. And the question they're asking, I think, relates to your call to intentionally seek out more affordable housing opportunities. The question asks, what are your thoughts about helping people who are developing, they're mentioning rail trails, but other things that make our community a wonderful place to live, to understand and put housing protections in place? And so I don't know if that's the way to address it, or simply having more affordable housing. And I'll open this up to any of the panelists who want to try to tackle this one.
I'll just start by, I think, clarifying that I think what the question is pertaining to is the talk of extending better rail service that would connect Western Mass to the Boston metropolitan area, which again may invite more people wanting to live in the bucolic Berkshires and Western Mass, but and how that will impact on housing stock, which we already just, we saw already with Keith's presentation that we don't have enough housing as it is. So it just comes back to this idea that we as a community, despite our success, we still need to be intentional. We can't rest on our laurels. We do pretty good relative to other communities with what we consider to be affordable, capital A affordable housing, but it's not enough. And if we don't keep active in making sure those units remain and or new units come online, that ratio is going to start to drop.
Yeah, and I would just add to that, that to Gordon's point about being intentional, there's different ways to be intentional, and there's different decisions that communities make, that the state makes every year relative to how we spend our resources. Pamela was talking about raising new revenue for affordable housing. And then you can target that revenue toward certain types of development. Communities can also target, create zoning or land requirements around certain amenities that could incentivize building more affordable housing in that place. If they can do that by different communities, depending on what they're able to do that through tax policy. Some do it by providing extra ability to build more, and others do it by providing subsidies to developers to get them to build more affordable units. And so there's lots in the solutions basket here, and that's been kind of tried and done in many communities across the Commonwealth as well as across the country, that we could borrow from that toolbox and put as part of an intentional strategy in our region. Again, part of that strategy has to be about setting real regional goals. Gordon was just talking about, feeling like Northampton has done well in building and supporting affordable housing development, but we're still not meeting all the need across various income levels. So what are the goals that we want to set? How do we do that as a community in Northampton? How do you do that regionally together and then invest in it regionally together? I think those are some of the pathways to solutions there. And the unique position we're in right now is that there's some new money around through the American Rescue Plan Act. There's still money that is not going to solve it all, but can create some opportunities for us to implement some of these solutions at the state level. The state in a bill using state and local recovery funds from the American Rescue Plan Act appropriated $600 million recently, most of it for housing production, both home ownership and rental. And that's at various income levels, not just low income housing. There's an opportunity at the local level with the same dollars to think about how to use those to invest in more affordable housing and toward an intentional set of goals and outcomes. So there's much more that we can be doing intentionally, to Gordon's point. I could go on, but I won't. The other thing, last thing I'll say is you need to make it simpler. So I appreciate what Dr. Bossi was talking about there. I see some colleagues on here who are in the affordable housing sector. We're talking and we're trying to make it as simple as possible, but it's a very complicated thing. It doesn't need to be. It doesn't need to be. We've created these complications for political reasons, for other reasons, to get around different folks' issues. The biggest housing production program for the federal government is the low-income housing tax credit, which is a public-private partnership, because we don't want to do it through subsidy because Republicans wouldn't go for it, right? So I'm just going to say that to you. They want to do public-private partnership, they can go for that. It's been successful. It's created lots of housing, but it also it's a complicated way to do it. Lots of lawyers, lots of attorneys. No offense to the attorneys or lawyers, which is the same thing, by the way. I meant to say accountants and attorneys. We don't need to be that complicated. If we can make decisions differently, we also need to make sure we're subsidizing the right folks. Lots of us get tax subsidies for being homeowners. We don't need them, most of us. That deduction you take compared to what that, and that's one of the biggest housing programs as well. We should be subsidizing the real need. So there's some choices to be made at the federal, state, and local level, and those are part of the solutions basket as well.
Great, thank you, Keith. I feel like this next question I was going to throw your way, you pretty much just answered, but it was can housing problems be solved at the local or regional level, or can they only be solved with major multi-year federal government intervention? I don't know if there's anything additional you want to say to that.
I would like to.
All the above, but go ahead.
No, that's perfect. I think I can answer a couple of the questions that have come through the chat. So another one is Dr. Bossi has talked about doing the public-private partnership and what kind of sort of challenges have I maybe encountered in that. And so yes and no, we have simplified the process. And I think the biggest thing when I moved into learning about housing, which honestly, I'm not that far behind anyone who's totally new here. I've only been doing this for 8 months. So, forgive me, but I think that I at least can be sort of more on the level. But I was very surprised that when we wanted to open, there was a property that my partner and I, we've been looking for a property for, 2.5 years. And one finally came on the market that was just perfect. And it was so obvious that, yes, this is the one. It has an elevator. It used to be, a nursing home. It's perfectly designed. All the bones of the building are exactly what we need. And we went to the state and they were like, yeah, well, okay, so in 2 years, we can, maybe get you the funding. And also it's going to be about $80,000 to apply for the funding. We were like, what? So that was a big shock. So what we did is we did exactly what the question is asking. We did all of it. We got funding from multiple different sources, but just in different ways. So we were so lucky to get an earmark from, Senator Joe Comerford. That's money that's coming from the state. We did apply for a federal grant through the Community Action of Pioneer Valley for operating costs that will eventually come from sort of the federal government. We applied for local funding through the city, through the CPA committee. And the biggest thing that made, I think the biggest difference was my business partner, he is sort of on his way out into retirement. He's a philanthropic person. He owns River Valley Rest Home. He has seen sort of why the rest home fails to provide care for people in multiple scenarios and really wants to do better for our community. And he had the money to just upfront purchase the building that was available right then. And then it wasn't going to be turned over and just turned into another business, which is what it is now. Just office space when it really needs to be housing because it's in a residential neighborhood. And so we were able to sort of come to the table with both public and private entities. And the idea of this is that we buy the property, we close next Friday. And we fundraise from more of the private sector, public sector, whatever, in the next year. And in 12 months, whatever gap we can't close, we take out a mortgage, and it's the smallest amount of mortgage that we would need at that point. So I think so far we've learned a lot of lessons, and the state is very interested in this model. They've been very clear that they are looking closely. We are doing our best to be perfect, but this is the first time we've done this, that anyone's really sort of tried to do this. And there are obviously going to be some learning steps, but we're very excited to have this opportunity. So that's the summary of multiple questions on the chat, and I did answer some of them individually as well.
Oh, great. Excellent. Thank you. Thanks. This one here, developers are building multiple dwelling units under the infill zoning, charging luxury unit prices. Is there a state law that requires a percentage of those units to be affordable? Is that anything that somebody can tackle?
I don't believe there's a state law that requires any of that, but there are, again, communities can certainly set, when they issue permits and things like that, and zoning rules, there's ways to get at what I think you're trying to see happen here. So
okay, and this same person is asking about ordinance requiring efforts toward racial diversity in new construction in the infill units.
That a question about kind of, I think maybe contractors who are developing the housing. I didn't see the question. But,
is it possible to have an ordinance requiring efforts towards racial diversity in new construction in the infill units?
So there are different the different funding sources sometimes require not on racial or ethnic diversity from who can live there, but who is involved in the development of the housing to make sure, so for example, minority and women-owned business enterprises get opportunities to develop housing. Less so on designating it around race. You get into fair housing issues there that kind of cut both ways there. So that would be a challenge to overcome those with making any kind of designation in that way. That said, there are ways to target opportunities toward communities and think about who is, when we think about equity here, where the greatest needs are and what the greatest needs are, who they're for, and how to target opportunities and create opportunity. For example, in our region, there is a huge gap, a housing tenure gap. Housing tenure is the way you get your housing, either by owning or renting it, if you have housing. So in our region, 70% of white households own their own homes. 30% of Black and Hispanic households own their own homes. That's a bigger housing tenure gap than the nation overall, than the Commonwealth overall. And so if you're trying to figure out programs that you could target toward creating more affordable first-time home buyer opportunities, it's going, you can think about how to create those, and the opportunity there would be created for everybody, but it also could be supporting those who have barriers or have not been able to break into homeownership, and people of color in that case. But
thank you, Keith. This next one is about how Northampton compares to other communities in terms of the level of affordable housing. Are communities measured in that way? And if so, how does Northampton hold up?
I think that they might be referring to the 40B standard that affects, what the process of getting permission to build in the community development. Northampton, like I said, Northampton relative to other communities, we do pretty good. And I think that we are above I think what is the 10% number that puts you in a special category. But we were very close a couple of years ago to falling under that. And it's only because of housing developed by Wayfinders and Valley Community Development that allowed us to sort of remain in that above 10% range.
what I would say about that's a 10%, again, that was a negotiated number, that 10%. That doesn't get us to what we need. That doesn't close the supply gap. So if you look at when you see the second phase of our housing study, according to the UMass Donahue Institute, they say in the region we need to be on average about 18%. So so again, we need to revise our goals for ourselves. The state should be revising those goals and then applying resources to them. As I mentioned before, the state has already allocated some money. They have another $2.5 billion to allocate of state and local recovery funds from ARPA. That can go toward housing. Local municipalities have some of those dollars as well. That can go toward housing. Obviously, there's lots of other needs too. So there are opportunities here. And as we think about new revenue raisers, like some that Pamela was talking about, how do you target those to around these issues intentionally?
Great, thank you. Are there other communities in Massachusetts or other places that you think are doing a really good job that you'd like to call out as a model?
So I'm an Amherst resident, so I'll give Amherst some accolades for some things that they have done of late. They have like in Northampton, there's a Amherst Affordable Housing Trust and a group of people there who have been advocating within the town, and they created a housing trust fund to designate resources for housing. And they have also recently targeted their city-owned property and gone out and bought property themselves to create affordable housing. So they saw the need for affordable housing in the community. They had a surplus site, but that was small. They went out and bought additional housing to make it more attractive for developers, and then put that out for RFP for that intentional purpose. So again, taking real intention, applying real resources, taking real action to create new housing units. And so those kind of actions you see, across the country when municipalities are really being intentional. They use all the tools that I just mentioned and more to create opportunities for affordable housing development, and affordable. It can be at various levels. So it can be at the lowest income levels where there's definitely a great need, but there's a gap also above above the affordable housing program standards that we're used to, that go all the way up to 100% of median income. Because again, we do not have enough housing supply for everybody, not just the lowest income. I think that's a really important point to make. This is an issue for all of us. This is an issue for your grandkids. This is an issue for your children. Will they be able to rent or own in the region if they're even just at the median income, the midpoint for all the income? They're going to be cost burdened. They may not be able to find housing. So you see communities like Amherst taking some aggressive actions to address that.
Oh, Lisa, I
Thank
see
you, Keith.
Carolyn.
I'd like to, oh,
Yes.
sorry.
Yes,
perfect.
sorry,
I was
I'm just
literally-
scrolling to, Carolyn Mish is here from the planning office for the city of Northampton. And Carolyn, we'd love to hear from you.
Thanks. It's great to be here, and great to hear all these questions. I actually have some comments on a couple of them, but first, just sort of backtracking a little bit to the zoning piece, because that came up in a question, and in particular about whether these infill units that are being marketed as luxury units, is there some way to address that? And so quickly, I just want to say that, actually jump on a point that Keith was mentioning, is we need housing units at all levels. We have made modifications to the zoning ordinance. Last year, we made multiple amendments to try to encourage new housing types, both targeting a faster path for affordable housing, so a local 40B process, so that it would reduce some of the impediments for going that some affordable housing developers have for going getting state approval for that process. But we've also modified and allowed sort of incentives for smaller units, because we know not only do we need smaller units to address people's family needs, but those are often much more accessible to people to get into the housing market because they cost less, because they are smaller. We've also adopted modifications to the zoning to allow two-family homes everywhere in the city. As far out as Sylvester Road, anywhere in the city, you can add a unit to your property, whereas we didn't have that previously. But there's also a cost to construction. So many of the units that are coming on the market now are coming in at a time where the construction costs are just astronomical and they're outside of anybody's control. So when people see a house that comes on the market that is $550,000, $600,000, it's not being built as a luxury market. It's a reflection of the cost of construction. And no matter who's building that housing, whether it's subsidized housing built as affordable housing, the costs are the same. And so it's whether or not it's being funded by the private sector or funded by the public sector. So I just wanted to clarify that many of the units that are coming on now are really built, they're expensive because of the cost. They're not being targeted necessarily for luxury units. And the real issue that we're seeing is, even though we've created all these new incentives for zoning or through the zoning, we allow lots of different kinds of housing units. The problem is when those projects are coming before the boards, all of a sudden the community support disappears. So going from multifamily housing down onto single family housing, we don't have the support for those projects. And so part of it is just we have a supply problem. Keith described that. And so we need to be supportive as a community of the actual construction of these units, not just the concept of changing rules and regulations and changing funding opportunities for such units. We actually have to be at the table when they're coming on board. And so, and then just finally to speak to what the city can do in terms of buying land for units. The city has been, Northampton has been involved for many years in acquiring land and giving it to Habitat or providing opportunities for Valley CVC or Wayfinders to build housing. So the city has done that extensively, has surplus public land. We're in the process of doing that in throughout the city, actually, in various places, on Woodland Drive, on sort of the corner of Rust and Chapel Street. So the city has definitely been involved in that kind of process where we find land and then turn it over for the development of subsidized affordable housing. And then with just one final note, though people talk a lot about inclusionary housing, meaning requiring developers to include a portion of their units to go for subsidized affordable housing or targeted affordable housing. It's really hard to do it in the market in Pioneer Valley because although the construction costs and the land costs are the same, or maybe slightly lower in terms of land costs in Pioneer Valley, we don't have the total number of units coming on board that we do, that places in Eastern Mass have. So it's much easier in the Boston market when developers are building 500 lot subdivisions to carve off 1 to 5 of those homes for affordable housing, because those can be subsidized across all of those other 450 units that are coming online. We have such a small market here that even building 50 units in a subdivision, if we require 2 or 5 of those units to be affordable, it's really hard for a developer to manage that small amount. And again, it goes back to the cost of the construction. It's still the same cost to build those units, but you can't spread that cost across as many units here. So it's much harder prospect to get regulatory requirements in place that require those private sector developers to build affordable housing. Thanks.
Great, thank you, Carolyn. Thank you for adding that piece to it. We're coming up to the time that we had originally intended to close. I think we're going to plan to go on for another 5 or 10 minutes just so that we can make sure to wrap up the questions and any additional comments the panelists might have. So I wanted to acknowledge that and understand if you need to leave us at this time. There was one question about the small house movement, the tiny house movement, and how that, how that might play into housing solutions. Does anybody have any comments on that or anything that Carolyn has said?
I know that
I can.
Oh, go.
Yeah,
Go, Carolyn. I
Carolyn might be the best for that.
I was just going to say, I think that we get asked that question a lot. Are tiny houses allowed? We don't have a restriction on house size. So one of the things we did last year was to create an incentive to create these smaller units, so that instead of incentivizing larger units, we've sort of reversed that, and in an attempt to encourage developers to look at that. And in fact, we have a first project that's going to come forward under that new zoning, where there are going to be 8 small units, 800 square feet, on a parcel that would normally just be allowed to have 4 units. So if anybody wants to come out and support new units, they can come look for the public hearing notice for a Williams Street project that will have sort of our first small unit project coming forward.
Could I just say something about the last point that Carolyn made, is that Pamela was talking about sort of the big advocacy at the state level for housing that's needed. But there is that advocacy at the local level too, because there is a significant barrier for developers is kind of the not in my backyard sentiments that we receive, and then that take place in these local approval processes that can often delay them. And delays result in costs. Often are there challenges, and also just kind of a disincentive to want to work in a community. So you want to be a YIMBY community, a yes in my backyard community, and really show up for these opportunities to support housing. Often developers are there And people, yeah, it's no surprise, and I know Northampton has seen this in other communities around where people come with all kinds of angles that are somewhat fringe, but sometimes they get loud voices and can create barriers. So it's important for people to show up and support these projects.
Great, thank you, Keith. Pamela, I'm going to turn it over to you at this point.
Thank you. I had 2 follow-up pieces that I wanted to give. One around the federal level question. I just want to put in the chat and flag. We're in the middle of a huge debate around the Build Back Better Act, which has in it 150 from the House side passage on the federal level, $150 billion worth of investment in housing, which is very much at risk of disappearing in the Senate. And again, we have to call it out. It is a Republican versus Democrat issue around this investment. That is what it is. And it's something that the National Low Income Housing Coalition is organizing very, very hard around. And again, we have a good fortune of having supportive Congress people who need to hear from us. And there's opportunities to sign on and underscore, but both sign on a letter if you're an organization. That's part of that, what was in that chat. And also just be in touch with our Congress people to say, to raise up attention to this. The other thing I wanted to, on a state level, is make people aware that Keith referred to the almost $2.5 billion remaining in federal dollars in Massachusetts coffers right now that we can choose to allocate to affordable housing. We can also choose to allocate to our rental assistance program that is right now slated to be out of funds in April, before the next fiscal year even begins. And these are choices that our state government is making to not grab some of these federal dollars and replenish this program. And there's nobody better than Keith who could attest to the level of demand for rental assistance, since Wayfinders is the door to it, where there's roughly 600 applications for rental assistance a week at Wayfinders alone. And so this program is about to be out of money. It was already restricted in January due to the expectation. We can do something about that. We can be heard about that. The great news is that our legislature already went on record, our delegation, I put this blog post here too. They went on record saying to the leadership, we need to do something, but let me be clear. So big kudos to them. They did that. And they are on to the next 20 pressing issues, 30,000 pressing issues. It is our job to bring it to their attention again, to keep pushing. So I just wanted to bring those 2 things to your attention: the federal action around the Build Back Better Act and the state action around the rental assistance that is at risk of ending imminently. So those are my 2 parting action steps.
Great. Thank you, Pamela. And we wanted tonight to be full of ways people can engage. So I really, really appreciate that. I'm now going to turn it over to Kathy Wicks, who is on the Northampton Human Rights Commission, for our closing remarks. And I apologize for not getting to more questions tonight, but your engagement here is really heartening, and we'll hope to do more. Kathy.
Good evening, everybody. It was so wonderful to have such a great turnout. Just to echo and repeat back what our panelists have been saying all night, that this is an issue for all of us. And you heard the landscape. You got a broad sweep of the landscape. We heard about some creative solutions. We heard about that it has to happen at every level, that we all need to be in this at the local level, the state level, the federal level, to ensure that that housing as a human right is something that is on everybody's mind. And so we were so excited to be able to partner with the library on this, this event. And thank you so much to Lisa and to Faith and Molly and Joseph, who are all part of the planning process. And thank you again to our panelists, Gordon and Pamela and Dr. Bosey and Keith and Carolyn. We were really appreciative for you stepping up and providing such a rich variety of information. We hope that this is the beginning of an ongoing conversation and for other events like this, because there's so much more to this issue that is an issue for all of us. So please, you have very real action steps that you can take. That if you haven't found them, the links in the chat, please look at them now before we close, but also go to the websites and join in the conversation. It doesn't take a lot of voices for the issues to be elevated with our legislation, but we have to add our voices. So thank you to everybody. And I would also invite, we have some open seats on the Human Rights Commission. So if you are so moved, we welcome you to join us on that commission as well. So thank you and good night, everybody.
Thanks so much.
Thank you all. Thanks for coming tonight. And we will follow up with an email too, I think, with some links, additional resources. So we'll send some things out to you along with the recording. Good night.